Good day, viewers. Last week we were talking about regenerative medicine, and we're going to continue today as well. Today I want to mention some of the things or other things that regenerative medicine can do for you. Today, let's take diabetes for example. Diabetes can be type 1 or type 2. The type 1 is more common in the children and young adults, and sometimes it could be caused by autoimmune disorder. Whereas type 2 is when somebody did not have diabetes and all of a sudden, maybe later during their lifetime, they develop diabetes. It could also be because of being overweight, many other conditions. I mean, it could be related to drugs, drug-induced, gestational. There are many conditions. But what is important is this. Any of the diabetes is being caused because of there's a misbalance between the insulin supply, the effectiveness of it of driving the sugar, into the in the blood stream, into the muscles, so that it can be used as a source of energy. This is a condition that affects many of us in Africa, and it is important that that is not the end of the world, thanks to regenerative medicine. With the understanding and the availability of adult stem cell therapy, today people can be taking off the diabetic medications, or the worst, they get to the minimal dose to address the diabetic issues they have. And to do this, we use for the source of adult stem cell therapy, we use bone marrow. Your doctor can decide to use fat, or it could also be umbilical cord blood. These are possible sources of stem cells that can help your body to regenerate. And the way it works is that the pancreas has certain cells. The islet cells are like a unit in the pancreas that produce insulin. When the patient is treated with adult stem cell therapy, the pancreas starts repairing itself, regenerating itself, having more units to produce this insulin that is needed. And what you find out that after a while, the patient will be using lower doses of their medication, their body is able to produce more insulin, and then eventually they can get off. Mind you, there's also another component, of this problem that we call insulin resistance. That is when there's enough insulin, but the muscles are not sensitive to it. Another benefit of using regenerative medicine for diabetes is that we can prevent all the complications that are associated with diabetics. If one, and by the way, the earlier one decide to get adult stem cell therapy to address the regenerative medicine, the faster and the more effective the treatment is going to be. By doing this, you're going to prevent complications of kidney failure, the heart being affected, deficiency of blood supply to the legs leading to amputation, and and many other problems. So it is very important that you understand, if you don't want to be on medication for the rest of your life, regenerative medicine could be an option for you. I'm Dr. David Ikudayisi, a US board certified internist and regenerative medicine specialist. I will see you next week to continue on other conditions that regenerative medicine can treat. Thank you for watching, and make sure you tune in next week.